The Blending Initiative, a collaborative effort between the National Institute on Drug Abuse and the Substance Abuse and Mental Health Services Administration, aims to accelerate the dissemination of research-based drug abuse treatment into clinical practice and reduce the gap that exists between the publication of research results and their impact on treatment delivery. The Blending Initiative comprises three main components: products and materials, meetings and conferences, and collaborative partnerships. Together, these components help facilitate the adoption of evidence-based practices within frontline clinical settings. Evidence-based practices combines research evidence with clinical expertise and patient values to provide the best possible outcome. Research evidence refers to clinically relevant research. Clinical expertise means the ability to use clinical skills and past experience. And patient values refers to the unique preferences, concerns, and expectations that each patient brings to a clinical encounter. Following this process allows for the development and packaging of an evidence-based practice that is not only useful, but also used. With NIDA and SAMHSA support, and through critical collaborative partnerships, the Blending Initiative's products and meetings reach a wide variety of professionals involved in the prevention or treatment of substance use disorders. Our audiences include physicians from all specialties, medical residents and students, clinicians and therapists, nurses and physician's assistants, educational and training institutions, healthcare networks, as well as partners in the legal and criminal justice settings. With these audiences in mind, blending teams of NIDA researchers, members from the SAMHSA CSAT ATTC network, and additional subject matter experts work together to design and develop various products and materials based on NIDA-supported research findings. These resources expand and improve the spectrum of science-based tools available to professionals in the community treatment and medical settings. Completed products include training packages composed of informational manuals, presentations, videos, software programs, and curriculum. Because blending products are developed to fill the specific training needs of the practice community, each product has a specific focus. The HIV rapid testing product provides resources to implement HIV rapid testing in drug treatment clinics. The buprenorphine suite of blending products was developed to disseminate important information and enhance awareness about substance abuse treatment using buprenorphine among multidisciplinary professionals, including its use for short-term opioid withdrawal, young adults, and prescription opioid dependence. The Motivational Incentives Package consists of user-friendly materials to assist in the application of motivational incentives when treating patients with substance use disorders, including a software program to facilitate implementation. The Treatment Planning MATRS package demonstrates how to use the Addiction Severity Index to assess a patient's substance abuse, help develop effective treatment plans, and monitor patient outcomes. Blending meetings and conferences provide a venue for researchers, providers, and policymakers to share innovative approaches to addiction treatment and participate in hands-on skills-building activities that will help with the implementation of evidence-based practices in clinical and medical settings across the nation. As NIDA Director, Dr. Nora Volkow stated, one of the most challenging aspects of what we've been trying to do is how to take the science that is developed through research funded by NIDA so that it can be implemented in ways that improve outcomes, both in prevention, but also in the treatment of substance use disorders. The communities that we need to touch are extremely diverse and go from community treatment programs into the healthcare systems. Blending meetings provide a forum where NIDA and SAMHSA can partner and share educational and management tools necessary to facilitate the transition of research into practice. NIDA and SAMHSA work closely with professional organizations, federal and state policymakers, and community providers to help identify strategies which accelerate the adoption of science-based practices. Working across boundaries promotes innovative activities that enhance public health applications of research, improve quality of available services, reduce obstacles that contribute to time lags in adoption of evidence-based interventions, and develop intervention plans that are as user-friendly as possible. To learn more about the Blending Initiative or to download blending products, please visit us online at www.drugabuse.gov/blending-initiative or www.attcnetwork.org/blending initiative.